Yes, hi, I'm Jo Myhre. I'm from Norway, junior doctor, and been in charge of the cable car challenge here at the International Forum. I have with me Frank Federico from the Institute of Healthcare Improvement. And Frank, how was it being a cable car captain?
It was a lot of fun. We had in our cable car about eight or nine people, I think it was, and representing 5 countries. And our challenge was patient engagement, unique ways that people can engage patients and bring them in. So the group first got to talk to each other and then just introduce themselves on the way over, which was a great exercise. Then once we got into the car, we had a question to ask, and each one contributed something. And we came up with a list of maybe 12 items of how people could be engaged, and then we used an opportunity of just some voting to say which are the most common or the most popular that we think are necessary. And the things that came to the top were things like co-creation of health, that is, patients engaged in their own care. One representative talked about the self-hemodialysis that occurs, how patients can go into the dialysis center and run their own dialysis, which is great. That's a great opportunity. People talked about empathy, clinicians being empathetic towards the patients, understanding what the patient's condition is, not just their disease process, but how they're feeling emotionally and an understanding that they're suffering. A major point that came up for everybody was enough time to consult with the patient. Many were saying that the doctors really don't have enough time and that need that extra space to do that. They also talked about training and support for patients. That is, we want patients to be more active in their own care, but it's easy to say that. What do we need to do to help them? So overall, it was a wonderful experience, and I look forward to the results of all the cable car challenges so that we can all learn from them. But I thought it was really positive, and I think the participants enjoyed not only the opportunity to see London from up on high, but it was also the opportunity to network and meet other people afterwards.
Yeah, and it was interesting because they had 2 challenges, even though it's a 20-minute ride. And on their way back, the same teams were to identify different safety measures with the cable cars and see how, if any of those aspects could be transferred to healthcare. So we had everything from the sliding doors, that some important processes should not rely on health professionals having to remember them, to video monitors, the marks on the side saying, for instance, no alcohol, or giving patient enough information, or giving people enough information to know what they should do. And I think it was taken to not an extreme today, but we actually had to cancel the cable cars today because of the wind, and that is maybe the most powerful safety message that we could. It kind of, when something is dangerous and it's not acceptable, we stop that. And maybe that is something that a lot of healthcare systems could learn from.
Absolutely. How many times does somebody say, stop the line, we can't go on, this is dangerous, somebody's going to get hurt? It's a great example. So it was great. Thanks for organizing the cable challenge.
Thanks for participating as a captain.